Mic check 1 2 1 2. GLRADIO. Get it locked in.
Right now, live and in the mix with your
其實咧，甩頭髮咧唔一定要植髮或者食藥嘅。
咁佢現時係咧全世界最 hit 爆嘅療程啊！美國
Right now, live and in the mix with your favorite DJ.
With Dr. Health Talk on GL Radio with Dr. Stephen. Health Talk on GL Radio with Dr. Stephen. Health Talk on GL Radio with Dr. Stephen.
Good afternoon, lovely listeners. My name is Dr. Stephen AKITI and welcome to GL Radio, transmitting live from Wenzhou, China. And also, remember to tune in even to our sister or partnering radio stations back home that we host them here in China. We have the Onya FM, Adum FM, and the likes. My name is Dr. Stephen AKITI, and I'll be with you on the top of the hour from now until 1:30 p.m. And as you always know, we come here with health-related issues, and we talk about them into details, raising advocacies and also educating people on health-related issues. For the past week, we've been talking about things relating to pregnancy. And last week, I made an extensive education on normal pregnancy, what we need to do when you're pregnant, how you know you're pregnant, what partners need to do when you're pregnant, and the whole importance of going to the hospital early when you're pregnant. Today, we're going to continue with that. And today with us, we have someone who is with the Children's Hospital, the Year-In Children's Hospital here in Wenzhou. She happened to be part of us as a Ghanaian and specializing in pediatrics. Now, before we go that, let's just have a recap of what we had last weekend. And we talked about how to diagnose yourself of pregnancy. We also said that pregnancy is a state where your immune system is down, so you need to take care of yourself. You need to go to the hospital regularly to check your BPs and your diabetes states, because when you start A and C clinic, those are some of the things they'll be checking to check for infections. You're going to check for the state of the baby, and then check for the state of you, the mother. And also, we advise that men who have their spouses or their partners pregnant should accompany them to the hospital when they are pregnant. We also said that when you realize that there's something about the pregnancy that you feel, or even any instinct that comes that the baby is not fine, for example, when the baby is not kicking as it used to be, rush to the hospital. And we also said make sure that you know what pregnancy is. That means you need to read more on pregnancy, you need to read more on your health, so that you can demand what is yours when you get to the hospital. Yes, you should be able to demand that you want to see how the baby is doing on the ultrasound machine. You should be able to demand that you want to know the state of the baby at any point in time. And also, lastly, we said that make sure that you do your anomaly test, your anomaly scans for the baby to see if there are any anomalies, so that you can take a decision on it. All this comes with pregnancy. And as I said last week, that pregnancy is a very big state in a woman's life, even in the family of that woman. So we need to pamper them, and we need to take care of them, and we need to take care of themselves. But then today we're going to go straight into the discussion for today. Today we are going to talk about prematurity, and for us in the health sector, even the world as a whole, we celebrated Prematurity Day this year on the 17th of November. We happened to be a Wednesday, and Wednesday has been assigned as the Prematurity Day of the world. And with all this happening, we decided to commemorate this day as a health talk show on GLRADIO, and GLRADIO that have been part of the leading health talk shows here in China among the foreigners. We decided to talk about prematurity, some of the causes and how we can prevent them. And with us today is our one and only Dr. Ajwa, who is training to be a pediatrician. Some would say a child doctor. So we will have her shortly on our show, and we'll discuss into details what all this is all about. So when she comes on, and hello. Okay, so we have Dr. Ajwa Jabbar with us. Dr. Ajwa Jabbar happens to be one of us. She's Ghanaian. She's at the Yuyin Children's Hospital here in Wenzhou, affiliated to the Wenzhou Medical University. She is quite awesome when it comes to kids, and that's her passion, I strongly believe. She was also part of the young scientists that represented us at the World Youth Scientific Summit that was held just last weekend. And I like to say that she's someone that we can all trust when it comes to giving knowledge on health and pediatrics. She's also part of the founding members and executives of the well-known Let's Talk Medicine platform here in China. Dr. Ajwa, welcome to GLRADIO.
Yes, Dr. Stephen, thank you very much for the kind introduction.
Oh,
it's a pleasure to be on this platform.
I hope I know I didn't really introduce you well. I decided to be modest.
More than.
I decided to be modest in the introduction. So, Dr. Ajwa, so we've been talking about pregnancy for the past weeks, and today we decided to talk about Prematurity Day of the world. We decided to mark the Prematurity Day, which happens to have fallen on Wednesday, 17th of November. And since that is your field, we said, why not call our one and only and our boss to tell us more about this day. We've read that all over the world they celebrated this day on Wednesday, and it actually started in 2008, if my memory serves me right. Yeah, but
that's right.
Yeah. So what is this day about? Like, what is Prematurity Day about, and what's our role? Yes, as well.
Okay, so first and foremost, I'm really excited to be given this platform to share on prematurity, because I believe it's something that we all have to come in contact with each other, know about it, and move together, because as it stands now, it is a global problem. So in simple terms, what is prematurity? I mean, when we say pre, that means before, in maturity. So that means that in terms of children, pregnancies, and childbirth, we have a situation where a child is born before the time that is stipulated, where we consider them to be fully matured. And so that is what prematurity is basically about. And you know, with pregnancies, we usually stipulate that at 40 weeks, we consider that a pregnancy is fully matured. But then we have a window, and that window is from 37 to 42 weeks, because we know not everybody will be exactly on the 40-week mark. So we consider that any child that is given birth to before the 37-week mark, that is before the full maturity state, is considered premature.
Oh, okay.
And so this awareness about prematurity has to do with raising awareness of the challenges and the burdens of such preterm births, and also to increase the standards for how we manage, these preterm births, and how to prevent even some of these causes or factors that lead to preterm birth. So basically, that is what the Prematurity Day is about, to tell people about it, create an awareness, teach them about the preventable causes, and also tell them about the ways in which we can manage the children that we already have who are born.
Oh, so So you're saying basically that Prematurity Day is to connect all those, to bring about support for all those premature babies,
to ensure that they have a good quality of life.
Oh. So this happened to be a day that the whole world celebrates, and if I'm being clear on this, that means that it's something that the World Health Organization has taken key interest in. But then, what is it like? If it's something that we are all looking at, how bad is it? Like in our population of the world, how
it really, the numbers are actually very alarming.
Oh, okay.
Basically, like, just imagine that every 10 babies we have now, one of them is premature. That's how common prematurity is. And we are recording numbers as high as 15 million babies each year. Just in a year, we have 15 million babies worldwide who are born premature. And most of these are found in the low to middle income population, the majority of them. And then because of the complications and all the issues that come with prematurity, we are recording as high as 1 million deaths in a year amongst the premature babies. So amongst the 50 million babies born each year prematurely, about 1 million of them are dying due to different reasons.
Wait.
So you can see that the numbers.
With Dr. Stephen.
Are you saying that we have over 1 million babies dying almost every year from premature?
Exactly. Yes, and this is just based on the records that we have. So imagine in situations and nations where records are not up to par, that means it's possibly even more.
Example, like babies that are born in Kumbungu, certain parts of Ghana, that we don't really
rightfully so. Yes, where probably the family just decided and discarded of it themselves or managed it by themselves without seeking the help from any health facility. There is no record of even such deaths and mortality. So those ones are not even in the records. So the ones that have been recorded, we are recording as much as 1 million deaths. And as at now, it stands as the #1 killer globally of children under the age of 5. So we see that there is a very important need for us to talk about this, because it's something that is killing the little humans on this planet.
But in the days, people always say that if you give birth to a child, that the child is so small, that means that you've either been cursed or maybe you are not supposed to marry that person, how far is the education on that? Like, is it still the same? You've been in the clinic and you've seen these people. Do we still have such ideologies out there, or you think that the awareness has gone furthermore to educate our people back home, or even educate people worldwide on how serious prematurity is? Because till today, people still have the whole superstitious belief of you giving birth to a preemie means that, one, that child is not of God, and two,
it's a curse.
Or you probably cheated on your husband,
Sadly, still all of these superstitions and ideologies are still permeated in our societies, which are backed by maybe cultural beliefs or religious beliefs or whatever that people have chosen to believe in. So sadly, every now and then you come into contact with a family that has a premature child, and they believe that maybe they don't have to seek any help, right, for this child. They believe that if the child survives, that means the child is meant to be. If the child doesn't survive, that means maybe it's a better thing for the child to pass on. So every now and then you still come into contact with families that believe in such things, because maybe they've never received any education about it, or they received a miseducation. What they heard was what was not the fact. As you said, people thinking that it's an evil child, or thinking that there's no need for them to seek help from health professionals. They can manage it by themselves. Some people have met a family that had a premature baby and they discharged themselves and went home thinking that this child can feed and can excrete. So there's no need for them to spend money and put the child in the NICU. But then the child was so low birth weight and so small, and they were just carrying, like they actually put the child in public transport on the train and traveled miles to come. And for them, they didn't see any urgency to it. And even at the outpatient clinic, as we are beckoning them to admit this child into the NICU, they still are like, we really do not get why you people are so acting as if this is serious, because this child is okay. But they didn't understand what prematurity came with it, the gravity of the matter, and that we needed to be very careful in how they handle things. But yeah, we still do have.
Anyway, I think since we have the opportunity to educate those who are listening to us now, I think we'll just educate them on it. But with this whole premature, what are some of the risk factors? Like, what are some of the things that will make someone have a baby with prematurity? Like, what will cause, what will have, like, what happens?
There are so many things that some of them we might not even pay attention to that could be causing some of the prematurity cases we see. I mean, first of all, when we talk about prematurity, it is related to pregnancy. So that means that one thing we should really pay attention to is the pregnancy, the before, the during, and the after. If they are able to handle these periods very well as they should, or even the bare minimum, just do the bare minimum to make sure that we have a safe before, during, and after period. That means that we can almost ensure that we are going to produce a healthy term baby. So most of these issues fall within the before period, the during, and the after period. So some of these causes that we have, especially in the low and middle income populations that you see, number one is an issue with like multiple pregnancies. So you have someone that has been pregnant over and over again, or at even one time that they are pregnant, there are multiple fetuses. And then such people, you notice that they also have short-spaced pregnancies. I mean, per advice, the space between your pregnancies should be somewhere between 18 to 60 months. So if you're getting pregnant less than 18 months after your prior pregnancy, that is an alarm. That is something that could also put you at risk of giving birth to a preterm child. And of course, the most strong factor here is if you have a history of giving birth to a preterm child. So if maybe your second pregnancy was a preterm child, that means that you have to be very careful because you have the potential to have a preterm child again. Other things like infection. As a pregnant woman, you shouldn't take any form of infection lightly. Maybe before your pregnancy, you would have some form of infection and you just manage it through, just buy some drugs for yourself or anything, any home remedy, you just use it and you're fine. But during your pregnancy, you have to really pay attention to any signs of infection and see your doctor before you even decide to use any remedy or drug, especially something as simple as a UTI. I believe many women before their pregnancy probably have experienced UTIs before. Mind you that...
Doc, what is UTI? What is UTI?
Oh, sorry.
Dr. Stephen.
So UTI, please, what is UTI? We don't know what UTI is.
So UTI, I experienced it before, and you handled it in one way or the other. But then mind you that when you're pregnant and you experience that again, it is not the same because now it has the tendency to affect your pregnancy. So
that means you're saying that when you're pregnant and you have any infection like urinary tract infections, you shouldn't take it lightly at all, isn't it? Okay, so
no, you should not. You should see your physician. This is not something you go and buy drugs from the pharmacy or any drugstore and just take it. Maybe your symptoms might come down or might go, but then you might have caused the harm already. So it's important for you to see your physician or any healthcare worker in your facility near you. And the next thing, one of the major things that also contributes to prematurity are these chronic diseases like diabetes and high blood pressure of the mother, and now even obesity. When we've seen that in obese women, there is an increased risk for them to have their children prematurely. And then when it comes to diabetes and high blood pressure, even sometimes maybe before you were pregnant, you never had any of these, but can be associated with your pregnancy. And so this is why your antenatal checks are very important, so that these markers can be identified in time, and then the necessary help and management plan can be meted out for you. Another thing with the causes or the risk factors, as I was talking about, is herbal remedies. During pregnancy comes with a lot of symptoms, which we understand are explained by pregnancy, but the human body doesn't like discomfort, so normally we will try to remedy it. And in our different societies or local, we have these traditional or herbal remedies that we use for the stretch marks, for the nausea, for the constipation.
Hey, you are saying we should stop taking the potakebites and the rest.
These things have been associated. Any herbal remedies, discuss it with your doctor. I mean, a very common one is ginger, and ginger products for nausea and vomiting. This is a form of a herbal remedy, but per research, it has not been found to be associated with preterm birth. Another common one is almond oil. Ladies, because of the stretch marks, because, beauty standards and everything. So now people start attacking the stretch marks even while they are pregnant. So they use some of these things to renew. Almond oil being used for stretch marks has been found to be associated with preterm birth. Oh. And so yes, it has been. And other things like chamomile and fennel, yes. And in the Asian community, you notice that ginseng is widely used. Yeah. And the fatigue that comes with pregnancy, they normally use ginseng as a remedy. But luckily, ginseng is not found to cause preterm birth. Okay. So the thing is, whatever herbal remedy, local remedy that has been passed on to you, maybe it's been used in your generations, be sure to discuss it with your doctor first to find out if it is safe for you and your baby. And another thing with medication is also over-the-counter drugs. I talked about this. With pregnancy, you have pain here, you have some reflux, you have constipation, and you feel like, I can just go and get me some anti-diarrhea drugs, or I'm coughing, let me just go and buy this, or let me get an aspirin. You have to, there is a list of some of them that are a risk to you and your baby, and some of them that are not. So as I'll always advise, discuss with your healthcare provider. Always discuss. That is the essence of your antenatal visit. Discuss all of these. At any point in time, when you consider that, I'd like to go buy this, discuss with your healthcare provider first for the go-ahead before you go and get these OTC medications, because the over-the-counter drugs, you don't really need any prescription. So you can just walk in and get it. Yeah. And that might be what will cost you and your family. So please be sure to discuss these with your healthcare provider as well. And something very simple as nutrition, the food we eat. It seems like a no-brainer, but then sadly, many women have suffered premature birth because of malnutrition or nutrition problems. First of all, just even having a balanced diet. We know that pregnancy comes with a myriad of cravings and our diets. You should mind that before your pregnancy, you probably did not have a healthy diet, and you're used to that. And so when you're pregnant and your cravings increase, most likely you'll be craving the things that you've already enjoyed in your lives all these years. And so if you already are used to an unhealthy diet, when the cravings increase, you'll be craving those things, because now you know what unhealthy foods that you enjoy or give you pleasure, and that is what you want to go for. But if you've also been on a healthy diet before your pregnancy, that means that when your cravings kick in, more likely it will be in that direction. Not to say that you might not crave for unhealthy things, but there should be a balance even with that. Make sure that you are eating well. Make sure that you are hydrating well. Make sure that you are not the weight. Check your weight. In as much as pregnancy, there is a physiological weight gain. You have to have that in mind and know what is the healthy range of weight gain. Because sometimes we let ourselves go and we overdo it, and then it also brings different problems to us. So with your nutrition, pay attention. And also with nutrition, you notice during your antenatal care visits, you're given supplements and vitamins, and there are these micronutrients that you need that probably are not found in our food or your everyday diet. So make sure that you are also taking these supplements. And as I mentioned before, the factors that affect this are the before, the during, and the after. So it is known that as a woman of reproductive age, you should be on your folic acid tablets, because the lack of folic acid when you're pregnant are going to cause neurologic brain deficits in your child. And so you have to pay attention to these things. If you have not been taking it, once you get pregnant, see your doctor, start, and be diligent with it. Be diligent with it so that you don't have any issues with nutrition. And it's not going to cause preterm birth. Something that we do not pay attention to is I have a lot.
So what you're saying is that for instance, the folic acid, we're not taking the folic acid on time, causing neurological malformation and also the spinal malformation, which in the long run also causes fetal anomalies, can also be a risk factor for prematurity.
Yes, it is, because the issue with prematurity is a child born too soon, and another issue is that not being matured. So all the organs, all the body parts have not reached its full maturation. And if it's not reached its full maturation, that means that they cannot function well or function on 100%. So that's the major thing. So that's why when you're pregnant, all these things that we put in place, all the tests we do, the vitamins you're given, they are all to ensure that the child or the fetus reaches maturation at 100%. That means all the organs are developed, every other part of the body is fully formed, such that when the child is born, they are ready to live life on their own without any support.
Oh, wow. Okay. Wow.
Yeah, so that is why nutrition, it is a major problem, especially in low-income countries and nations where there might be many factors. So it is actually found that prematurity has an increased risk in poorer families and in poorer communities. Yes. First of all, your risk is increased because you are from a poorer background or a poorer family. Because when it comes to all these things, your antenatal care visit, your nutrition, even on the basics, to have the pregnant mom eat a three balanced meal each day, make sure that they are not anemic. Because pregnancy takes a toll on the body. So that means you have to put in extra work when it comes to your nutrition. You can't just eat anyhow or eat like you feel alone. You have to consider the science behind it and then eat as it is needed or required of you, knowing that you are growing an entire human being in yourself, in your belly or in your uterus. Yeah. And another thing that might be shocking to most is sleep. Your sleep. Yes. People who do not have adequate sleep and rest during their pregnancy have been found to have an increased risk of premature birth. We take sleep for granted. Until you are not able to sleep, you might be taking the ability to sleep for granted.
But
as we said, pregnancy, as we know.
But Dr. Adjoa, looking at things, pregnant women still go to work when they're pregnant. They may get their leave starting from probably 3 weeks. So they give birth, or even some of them may not even take that leave. They'll just wait till their water gets broken.
Yeah, labor.
They're labor.
Exactly.
Yeah, but if you're talking about sleep, are you talking about they sleeping the normal 8 hours of sleep? Because sometimes, in this world of gender equity and all that, you have women who are also in all the fields that men are in, and they also do the night duty. Some of them even do the 24-hour duty.
And that the demands are higher, the responsibilities are more. I completely understand your side, but what I'm saying is, at the point where you're pregnant, irrespective of all other responsibilities, you also have to come to the understanding that you have a new responsibility now, that is creating a safe environment for your child to thrive and thrive fully and mature fully. So what is the essence of managing your responsibilities and thriving at it, and your child is being born premature and you have problems with that? What is the essence? Because I believe you wanted a child if you're keeping it and you're growing the child in you. And so whatever you need to do to ensure that you're providing that safe environment for them to thrive and mature, it should be a responsibility that is also at the top of your priority list. And I think I really understand your point, because this should also be communications or conversations had in the career world.
Yeah.
To make sure that we also accommodate those things, making sure our pregnant women are prioritizing some of these things and not being left out just because they are pregnant at that point in time.
Wow.
So when I say with sleep, we know first of all the physiology of pregnancy alone can affect your sleep. I mean, with a bulging tummy, you don't even know how to lie down, and most pregnant women will attest to that fact. Taking aside maybe the baby kicking, back pain, all these symptoms that come with it, sleep already can be truncated. So that means you have to put in extra, you have to be cautious and be intentional about having enough sleep. If there are many products on the market that can help you feel more comfortable in your bed, that can help you maybe achieve better sleep. Maybe you have a problem with initiating the sleep, because the problem with sleep is it's either you have a problem initiating the sleep, or after you have fallen asleep, you have a problem maintaining it. So some people, it's difficult for them to fall asleep, but once they fall asleep, they can sleep. And some people, they can fall asleep easily, but then short periods of sleep. So they don't really achieve the full benefit of sleep. And if you're not sleeping well, sadly, it's going to increase inflammatory response, and that triggers premature birth. And so you should know that once you're pregnant, we know it's hard. We know the symptoms are difficult. The symptoms cause difficulty with your sleep. If you notice that your sleep has changed drastically from before, discuss it with your doctor so that they find ways to help you. As we said, if there are suggestions of products that could help you to sleep better or whatever, I don't think it will come to the level of medication. It has to be very necessary. Even that one, it is per the consult of your doctor. So do not take for granted the ability that you are not sleeping well during your pregnancy. No, it can affect you and your growing child. And so please really pay attention. Spouses should be supportive and should also, it's a team effort, So if you're also a spouse with your partner is pregnant, and you notice their sleep patterns have been off and all of that, you all should come together and work towards it. Maybe if there's something you have to do, there's a sacrifice, whichever, create a conducive sleep environment. All of these things contribute to that, so that both mother and child can be healthy and develop to term.
Sure.
Yes, and the next thing, which is now the buzzword of our time, is mental health. Mental health.
Okay.
Mental health. It's been found that in pregnant women who were depressed or showed depression, it's been associated with preeclampsia. And it's also been found that pregnant women who had symptoms of anxiety or with stress have encountered premature birth and children with very low birth weights. So we see that the mental health of the woman during her pregnancy is very important. Avoid as many stresses as you can. If you have anxiety issues before pregnancy, that means during pregnancy, it's likely to heighten. So seek help. If you've not already sought help, seek help. If you already sought help,
Health Talk
update
on
your
GLRADIO
mental health
Dr.
practitioner
Stephen.
so that he's going to help you through it. Because there are a lot of anxieties that come with pregnancy.
So wait,
even as
Doc,
a normal mother.
Doc,
Yeah.
so you're saying
Yes,
that
Yes, Doc.
it's shown that anxiety is kind of associated with
Premature birth.
yes, and apart from that, with preeclampsia, isn't it?
Yes.
Okay.
Yes.
Okay. And to viewers, preeclampsia, it happened to be hypertension pregnancy complication, or in medicine we call it hypertensive in pregnancy toxemias. So it also comes in relation with hypertension. So wow, then this is like a whole range of risk factors to be looked at. I mean, pregnancy in itself is not a joke.
That's what I mentioned before, that for us to achieve this, our goal is a healthy pregnancy. If we're able to achieve a healthy pregnancy all round, we can almost certainly say that we are going to eliminate, the risk for premature birth. Even though it's been shown that there might be a genetic component to that, but that composition is not so much as compared to the non-genetic factors. Most of these things are modifiable, or there are things that we can prevent or change or modify them. So it's all about us knowing. Most of the time, you have a pregnant wife at home who is under massive stress. All you think is, oh, you're just quarreling your partner, or just, oh, but it's beyond that. You have to understand. That's why I say that it's a team effort. The man, the woman, you all have to come to the understanding. There are people that are not in the most ideal situations, and there are pressures and stress. Try your best to avoid as much of it as possible. If you're stressed, find ways to de-stress, to get away from all of the clutter and all of the noise and everything, and just relax. And the last risk factor I want to mention has to do with environmental hazards. Ideally, these shouldn't be things that you're exposed to, but maybe, as we mentioned now, women are in lines of work and careers that, men used to do, in quotes, some years back. But now, if you know that you're working in certain line of work, like maybe those in the mining industry, the oil and gas, and you have exposure, or even with research, scientists, you have exposure to certain chemicals. And I believe when it comes to work safety, they educate you about these things. So when you know that you find yourself in such a space and you're pregnant, you find yourself pregnant, that means you have to be extra careful to avoid almost no contact with these hazards that are in your environment or your workplace, and maybe even in your home. If there's any such thing, make sure that you deal with it, because all of these things can affect and induce or cause premature births.
Okay. Wow.
So as you've said, major things. But the basic things in our society. Sorry, I'd like to just put this out. The basic things in our society, everyday things, the infections, the herbal remedies, the over-the-counter drugs, the nutrition, the sleep, the mental health. These are the basic things that we see are lacking and are causing a spike in the number of premature births we see. So we should pay attention to these things.
Wow. Okay. Lastly, before we actually move on to other things from the risk factors, one thing that we've realized is the use of tobacco, alcohol, and the rest among the general youth, and also even people nowadays think that when you're pregnant you can still indulge in such things. Is this also are these practices also related to some of the risk factors of prematurity?
Definitely, any form of substance abuse. And with the tobacco exposure, it's even worse. Let's say if you have a second-hand exposure, maybe you live with a partner who is an active tobacco user or cigarette smoker, so you get a second-hand exposure. It causes damage. It puts you at risk for preterm birth. And so, yes, substance abuse is all the substances mentioned and unmentioned, and with tobacco as well. So you have to avoid those things. Are like completely avoid them. Even if you're a user before months, the problem is even when you stop and you don't stop early enough, it can still affect the child. How much more when you do it during pregnancy? Even if you've been doing maybe 6 months prior to your pregnancy, maybe you didn't know you were pregnant, and then you stopped just when you realized you were pregnant, it still has a likelihood of affecting your fetus and causing preterm birth and causing other complications for the child after birth. And so imagine this scenario then. That means it should be something that should be avoided at all costs. You should try your possible best. If you have an addiction to it, you might probably need help managing your pregnancy, and that's during the time. But it should be something that it's a no-go area for a pregnant woman. Avoid any form of substance abuse.
Wow. So anyway, for all those listening to us, this is GLRADIO. We are transmitting live from Guangzhou, China.
Health Talk
today,
on GLRADIO with Dr. Stephen.
With us today is our own Dr. Ajajaba from the Yuyin Children's Hospital of Guangzhou Medical University. We are talking about prematurity. You tune in. Please invite your friend to listen to us now as we move on.
On GLRADIO with Dr. Stephen.
Yes, so welcome back. Dr. Ajula, thank you so much. But looking at all this, what are some of the things that we will see? Like, what are some of the clinical, clinical features, or how do you identify that the baby I just gave birth to It's a preemie, as people call it. It's a premature baby.
Oh, okay.
What are some of the things that we will see?
So,
even if I'm not a medic and I see this baby in the hospital, I was like, oh, so this is how premature babies look like. What are some of the things you will see? Then after that, we'll go to how to even handle them. Yeah.
Okay. So with a premature baby, as we've talked about something that's not mature, let me use an example of a fruit. When a fruit is not really matured and has passed its course, you're going to identify that by the physical features, right? So once you see it and you look at it, you notice, oh, this is not matured. It's very similar to a premature baby. Once you look at the child, you will know that this child physically doesn't look like a tame child. So one of the major things you notice is the size. The size of this child is way smaller than is expected to be. Yeah, so that's one major thing that you notice. So once you look at the child, even in the absence of any deformities, malformations, the size, because it's not fully formed, is going to tell you that this child is not mature or up to 10. And then there are other, that's for the general public to know, but as clinicians, there are other external physical features that we look for. Like we look at the ear, the pinna, the ear cartilage. We look at the crease at the sole of the feet of the child. There are some things that we can look out for. But just to the parents, when you give birth to your child, you notice my child is very small. And first of all, you also know that you gave birth before 37 weeks. So if you gave birth before 37 weeks, whether spontaneously or whether it was induced for medical reasons or induced for non-medical reasons, that is one thing, that your child is premature. And another thing that we would know is now by the way the child's body functions. A very common function is like breathing, because when you give birth, the next thing you expect is for the child to breathe, and to cry and to eat. And so those normal bodily functions, those are what we look for. This child probably cannot breathe on their own, has difficulty breathing. So you notice, usually when you give birth to your child in a health facility, we have a score called APGAR that we use to determine how well the functions of this child how well the body of the child is functioning. So a very common thing, the major thing is breathing, because first of all, if you're not breathing, you consider that you are not alive.
With Dr.
So
Stephen.
a major thing for premature children, and the major cause of death is acute respiratory failure. Like they fail to be able to breathe. Like the lungs are not in that capacity to function and breathe in and give them the oxygen that they need. So that's a very common thing.
Okay, but since we are also talking about some of the problems we see in them, let's just keep talking about some of the things that we see in them immediately they are born. Some of the problems that we may find when you give us a preterm baby. That is very necessary, and that makes you the health workers, or we the practitioners, advise our patients to keep the babies in the NICU, and also for them to be looked after. So if we can elaborate on such problems, short-term problems that the child may face if we don't keep them with us, I think the public will get to appreciate it more.
So as I was saying, I mentioned earlier that the major issue with preterm babies is that they usually die from complications. That means that once you are born preterm, you are susceptible to certain types of issues that normally you shouldn't encounter. And these types of issues are what eventually kill them, not actually the fact that they were born preterm. And so major thing is infection. Even a term baby, immunity is that thing in our bodies that fights against germs and exposure to bacteria and viruses. Even in a term baby, their immunity is not that strong. It just can take so much. So in a premature baby, the immunity is almost non-existent. That means that with the smallest contact with any form of germs, they can have infection, and during infection the symptoms are like blown out of proportion. And it's not even you can have a premature child have an infection in the lungs, and by the end of the day the whole body is infected. That's a sepsis. It's in their bloodstream. Because first of all, the body size is small, the surface area to conquer is smaller. So the germs just spread. So infection is one major thing that takes such children away. Another major thing as I mentioned already, is the respiratory failure.
Okay.
They just can't breathe.
Okay.
So if you're not able to breathe and put oxygen in your body, and all the other organs will die. Like it's a whole process. So the basic thing is we want these children to be able to breathe. That's why we ask you to put them in the NICU, because in the NICU we have no magic, but then we put them on special machines to help them breathe. And that is where we have that machinery. So we tell you that you need to put this child in the NICU so that we can put them on that machinery. And also the expertise of such people to make sure that there is no sputum blocking, you know, all these things to make sure that airway is clear and patent so that this child has a chance at breathing, whether assisted or by themselves. And another thing is with the breathing again, depending on how early it is, there is something we call surfactant. It's a type of, that naturally in the lungs of a human being, there is this fluid, this liquid that, let's say, the lungs are found in, sort of. And so that liquid is produced naturally during pregnancy and when the baby is developing. So here's a problem where the baby is born too early. So that liquid never developed or formed or even has just a little quantity. And it's needed for respiration. So that means we have to administer that as quick as possible. That can only be done in the NICU setting. So you see that the NICU is just, as we say, intensive care unit. Normally when a mother gives birth, the mother cares for the child.
So you're saying that NICU,
now we need a special care.
You're saying that NICU simply means that babies ICU. Babies neonatal.
Yes.
Okay, babies intensive care unit. Okay.
The child you just gave birth to is known as a neonate.
Okay.
Right. And so there is an intensive care. That kind of neonate who is preterm requires intensive care, not the normal care that the mother and the family can offer at home. That is why usually you are asked to admit your child into the NICU. So your child being in the NICU, essentially they'll be doing the basic things that you would have done if you would have had a term baby. Feeding, making sure they are breathing, making sure their temperature is kept warm, you know, those basics. That is what they are doing at the NICU. But this child is not like any other ordinary child. So we need special attention. We need special mechanisms. We need special expertise to handle them. That is what the NICU is for. Yes, exactly. And so you see that such children, I've mentioned infection, I've mentioned respiration, like breathing problems. And another thing, they might have malformations. We call them congenital malformations. As we said, there's a problem with maturity. And in the forming of a baby, so much happens that if the time required for the baby to form fully is not there, or it's cut short, they are like, you could have the baby with certain organs out of place. You could have them with certain holes in places where they are not supposed to be, because naturally when the baby is forming, it's a whole process. Certain holes are supposed to close, certain places are supposed to open. So if they do not get the full time to do that, you might have a child where certain holes that are not supposed to be there are present and are causing problems. Or you have a child where the intestines are outside of the abdomen instead of being inside of the abdomen. So these are all abnormalities. And sometimes when you give birth to a premature baby, and you just see that on the baby, you know that this is premature, like this is a problem, and it has to be solved and managed by the specialists. So congenital malformations are big.
So these are like things that we expect to see immediately if we don't take care of these babies. But what about the long-term effects? Someone will say, what if these things are, what if we don't take care of all these things? What are some of the long-term effects?
Sadly, the long-term effects are, I think most people think that the most difficult part for the parents or the family is when the child is in the NICU. But actually, the most difficult part is after they have left. And you counting every single minute, watching out for every milestone. Like, you just want to make sure that they make it. But with these celebrations this year, I think one of the most touching things I saw online was, I think one of the hospital facilities holding a graduation ceremony for all the premature babies that they have had over a year. And for me, that was so meaningful, because it's like we are graduating these children to life, because they've now reached the developmental milestones. When we say these milestones, like they are talking when they should be talking, they are calling when they should be calling, they are, you know, they are growing essentially as they should. And that for me was very touching. Unfortunately, with premature babies, the problems can last as long as to age 5, age 10, and even beyond. When it comes to issues like hearing, Some of them might suffer from hearing loss, hearing problems. Some of them might have vision problems.
Yeah.
Some of them have problems with their brain because in premature babies, maybe normally some of them suffer like from jaundice, and maybe if it was a 10 baby who suffered from jaundice, the impact on their body is not going to be as much as in a preterm child. Some of them, as a preterm child, they have a likelihood to just bleed at any time into their brain and into all the spaces in their body. And so sometimes after all of that, after all the rescue from the health experts, you still have a child you go home with who you have learning difficulties, or it's just, it takes extra.
Wow.
Yes, it takes extra for their cognition. Most of them leave requiring many months and years of physical therapy, speech therapy, all sorts of these years. So they might suffer from language deficit. They might suffer from speech problems. They might suffer from listening problems.
This thing is very serious, eh?
It is. It is. So that's why I say that the decisions you make before, during, and after your pregnancy could cost you the next 5 to 10 years of your life as a family. Showing that this is very important for us to discuss so that we tackle these things from the very root. We'll be very glad if we should hear that the numbers of premature babies have decreased in the millions per year. I mean, that would be very positive news. And so some of these issues the child might face many years after. I have met children with malformations where they have to be on oxygen even after they are discharged. Parents have to be suctioning. Suctioning means to remove the flange and the sputum. And they do it many years even after they've been discharged. Sometimes things might not, the healing process might not go as expected.
Yeah.
You know, even though we do all we can, we anticipate that this child will heal and probably should be able to eat food normally and pass urine or stool normally.
Yeah.
You can still have many years down the line they're not able to eat food normally, or their GI tract, the gastrointestinal tract, still has problems with, adapting to the food and all of that. So there are many things that could go wrong. Essentially, every body part could be at risk.
Wow.
When it comes to such children.
I strongly believe that with dedication and advocacy ongoing, we are going to make an impact in the lives of people moving forward. If they'll only listen.
Yes.
Yeah. And because of our time, I think we'll have to invite you again for a part 2 of this. But before we go, in the next 5 minutes, one thing that have been championed with all this prematurity and all that has been the kangaroo mother care. Can you just throw like little or small light on this for us before we say goodbye?
Yeah, so we've identified that this is a major problem in the health community, in our communities. And so, of course, solutions have been proposed. And one major body globally, I told you it's a global problem, so it's been attacked from the angle. One global body, being the World Health Organization, has come out with solutions or proposed solutions. And that is having feasible, cost-effective care in childbirth and in the postnatal period, because we understand that things like socioeconomic status and all, we can't change them. It is what it is. So then what can we do now? We should have things that work for us. That's the feasibility and the cost effectiveness, so that even the low income, the in quotes poor person, can still afford such things. And so there are 2 major things that are being championed in this solution structure. And the first one is antenatal steroid injections. That one has more to do with your doctor and physician. And the one that has to do directly with the mother is the kangaroo mother care, also known as the KMC. So the kangaroo mother care essentially is when we have the child and the mother having skin-to-skin contact, like the mother caring for the child directly and having skin-to-skin contact and feeding the child as well directly. But as we said, normally, if it was a 10 baby, the mother would, do all of these things without any help. But in these preterm babies, usually they are admitted into the NICU department, and they are separated from the mothers because of, the way everything is not normal. It's not in normal circumstances. And we've noticed that this separation somehow does more harm than good. And so that is why right now when we talk about prematurity, that is why when we talk about prematurity, we are championing for mothers to have access and give that care, because that skin to skin contact has been shown through research to help children thrive. There is something we call, sometimes we have children, we give it to children, we say that they are not thriving. You can be giving them the food, you can be doing everything you should do, but the child is just not thriving. But we notice that when they have that skin to skin contact with their parents, there are these brain things, things that are released, and somehow it shows the child begins to respond to maybe the treatment or to the food that they are being given. They are gaining weight and all of those. So there is a strong advocacy for immediate kangaroo mother care, even in preterm babies. Because we notice with the kangaroo mother care, it's something that is there for 10 babies. Usually when you have your baby at 10, you will have that, you have the opportunity after discharge, you're with your child all the time, but that is deprived. And the problem is that deprivation doesn't just affect the mother, but it's apparently affecting the child as well, and even being a factor as to whether they are able to survive or respond to the treatment and all the interventions that are being provided. And so right now, World Health Organization is running 2 clinical trials, one with the steroids and the other one with the kangaroo care in middle and low income countries. And they are seeing that there is better outcome associated with allowing the mother most of the time to have that. When we say kangaroo, you know the way kangaroos are, they keep their little ones in this pouch in their front. So that is where the idea comes from. Yeah, it's where the mother, have that skin, maybe just have the child on their chest, or maybe, let's say, the upper part of their body, chest, abdomen area, without clothing, and just, do their thing, bonding, whatever it is that you see. But then there is more to it than that ensures that these premature children thrive. And now this conversation is even a bit more complicated because we are living in unusual times where the pandemic has set in, and a lot of hospitals have more restrictions and the protocols are now tightened. We are not allowing people to easily get into the wards, not to talk of the ICU. And so somehow this can also be a problem. But then I believe there is a way we can go around it, making sure that, number one, the mother or the parents are tested for COVID and we know they are safe, and, getting skin swabs, just doing our parts to, we have to do almost everything to make sure that we can get them for this kangaroo mother care, unless it is an unavoidable thing. And maybe the mother is not available or something for some reason. Yeah. But once it is possible, this is a feasible and cost-effective way that we can manage after we have had preterm children, and to ensure that they thrive.
Okay, wow.
In addition to all our interventions.
Wow. So listeners, we've been talking about prematurity today, and with us have been our smart, intelligent Dr. Adra Jabbar, who is currently a pediatrician in the making in some few months. Thank you so much, Dr. Adjo, for joining us. But before you go, if you can just share with us your social media handles and some of the things you also do alongside just educating us on health, so that our listeners can also follow you.
Oh, okay. So I'm not a big socials person, but then one thing is I'm a big advocate for medical education or health education, just to make sure that the masses are you have to know about your health. You have to know about the basics. They're not expecting you to read out all the big terminologies that your doctor will say to you at your clinic visit. No, but at least you should know the basics about your health. You should know the little things you can do to make sure you are healthy. And so I'm a big advocate for that. As you mentioned, I'm currently with Let's Talk Medicine, which is also another big advocacy for medical education. That is in raising the up-and-coming doctors, up-and-coming physicians, health workers. And so that's something I'm passionate about. I currently do something called IMG Connect, but that one is more based with international medical graduates. That has to do with the medical field, giving tips and pointers on how to manage and navigate the path of training into working as a medical graduate or a physician or a scientist or a medical professor or teacher, whichever pathway you want to take. So these are the. So
if you want to follow Dr. Adra, you go on YouTube, IMG Connect, and you'll find her episode there. Please subscribe, follow her, and learn. And also follow us on GL Radio as we continue with our programs. Today is the 20th of November, and we just finished our health talk show. Dr. Ajo, thank you so much for honoring our invitation and also giving us such
Thank you very much for
education. Yeah, we are so grateful. God bless you. And to our listeners, God bless you so much for being with us and for the support. We come to you next time, next week, and keep tuning in to the next program on Destiny's Life.
Yeah, keep tuning into GL Radio.
Thank you
for all your health talks and knowledge.
Thank you so much.
It's credible.
We are not going to pay you for that advertisement, though. Thank you so much.
I said I'm passionate about health education, so it won't pass.
Before we go, we just want to give a shout out to Kwame. He's been one of our major listeners of the program. Kwame, a big shout out to you. Marianne, thank you so much for tuning in for today's. Marianne is also a medical student with us here. Yeah. So let's get ready for Dreams and Destiny as we move to the other studio to listen to some Dream and Destiny talks with our own Dr. Samuel from GL Radio. See you next week, and I'm out.